Hi and welcome. Now this little tip is about waking up without the mask on and pulling it off in your sleep without you actually being aware of it. Now this is very common and can alarm new users in the early days. So this behaviour can actually last off and on for up to a year, but most settle within the first couple of months. And there's lots of reasons to do that. Now, a little tip is to actually, if you've got an automatic start on your machine, so most of the newer machines have automatic starts now, so you can actually turn that off. So you'll have to start it manually yourself, but during the night the machine will continue to run when you pull the mask off, and most times you will wake up because of that noise. It's just annoying. So then you wake up, turn the machine off, pop your mask back on again, turn it on again, and away you go. The more you actually put it back on again, the more that the brain actually resolves and stops pulling it off. So there's several reasons why people do this, and I'm just going to outline the most known ones for you. So the first one is the mask is not correct. It's not fitted correctly and it's uncomfortable. So over the period of the night, you'll put it on at the beginning of the night and it'll feel okay, but over the period of the night it becomes uncomfortable, and so or it will start leaking. And so the brain doesn't like that. So it'll actually then pull the mask off because it's annoying and it's hurting. So if you wake up during the night again, just pop it back on again. Just make sure that it is fitted correctly. So on this channel, you'll actually find the 3 top brands with all their videos. So if it's a ResMed or a Philips or whatever mask, find it in the actual channel and then have a look and make sure that you're fitting it correctly. So there's fitting guides in there and they show you exactly how to fit the mask and how to do the straps and all that sort of thing. So check those out to make sure that you're actually fitting it right. The next one is nose blocks. So it might be fine at the beginning of the night and you're feeling okay, and then as the night goes on, the nasal passages actually dry out and that it causes you to feel blocked. So you'll rip it off because you feel like you're not getting enough air and you're suffocating. So there are some sprays that are oil sprays that you can get, which actually coat the inner lining and increase your humidification, particularly in these early days, because you will just because it's early, you will start using like drying out. So just increase the humidification to get more moisture into the airways, and it will hopefully resolve itself. If it doesn't resolve itself, then it's a good idea, or if you have seasonal blockages, then it's a good idea to maybe have 2 masks. So have your regular mask, and then on the nights that you're blocked, have a full face mask. So you can use that because you can actually mouth breathe on a full face mask. So it'll stop you from having to rip it off because you can't breathe. So that's an alternative, is to have the 2 masks. Next, we've actually got not enough air. So you're ripping it off because you're not feeling that you're getting enough air. Now, this could actually be because, so with an automatic machine, if you're on an automatic machine, it actually has a varying pressure. So it starts on a low pressure and then it will increase and decrease according to whatever your needs are. So it will get up to the maximum pressure and then come back down to a lower pressure and then go up again. And sometimes when it reduces to that low pressure, unconsciously you don't feel like you're getting enough air because you're conditioned to the higher pressure. So unconsciously you'll rip off the mask because you don't feel that it's comfortable. Now, a way around that is that with some brands and the more modern machines, you can introduce what's called an air splint, and that's where on the automatic you have a minimum pressure and a maximum pressure, and your minimum pressure or start pressure might be 6 and your maximum pressure might be 15 or 20. So let's say it's 15. So what you want to do is leave the maximum pressure alone, but with your minimum pressure, bring that up to about 10. So the machine will then be set from 10 to 15. Now don't panic because there's a way around this. So what you can then do is introduce what's called a start pressure. And so you start the pressure on 6 and introduce a ramp from, say, like 15 minutes maybe. And so you'll put the mask on and it will slowly over that 15-minute period build up to the pressure of 10. If it gets to 10 and you're still awake, just turn it off again, turn it on again, and you'll get another 15 minutes on the 6. So it will slowly build up to that 10, and then when you're asleep, it will vary between 15 and 10. Now, it won't go below 10, so you're getting that higher splintered air, which makes it more comfortable. It also gives you more apnea support as well, so it's not a bad idea just to do it anyway. So it won't come below 10 until you physically wake up and turn the machine off. And then again, reset the mask, turn it on again. You'll get 15-minute leadway, and then it'll vary between 10 and 15. So that's a good way of getting around that, so that you can keep that automatic status, but have it more comfortable for you. So, and usually find that with big chested guys that just want that little bit more air when they're actually starting off. Now, the other reason is not accepting the treatment. So you might be coming to terms with having sleep apnea and using a device to breathe at night, but it can be a little bit disconcerting in the beginning. So you may resign to it, but the brain actually rebels at night, and then you just remove the mask in your sleep. And I call this naughty child syndrome. So again, it's just perseverance and patience. So again, like a naughty child, you just persevere and try and break the habit. So put the mask on when you wake up at night, put the mask on again. If you find it off again, put it on. Try and not throw it against the room or throw it against the wall, and then it usually resolves itself. You will win the battle in the end. So, and then just to reinforce it, I've said these tips in previous videos, but just try placing a copy of your sleep study with the graph. So that's the bars with the apnea and the oxygen and the pulse rates in your sleep stages on it, next to your machine or somewhere where you'll see it when you go to bed, so that it's reinforcing to the mind that this is the reason you're using it, and that the CPAP that's what it's designed to do. So it just reinforces it and sort of gives you that little bit of push to keep going with it. So I hope that helps. I hope that that makes sense. And so we'll move on to the next video. So thank you for joining me, and see you in there. Thank you.